The Moral Right to Healthcare by Elena E. Borden. Healthcare. President Obama fought hard to make healthcare affordable for everyone in America. 2008. President Barack Obama has said that it should be a right for every American to have health care. At first, I won't. As this hospital's compliance officer, it's my job to make sure all the staff follow internal policies as well as regulatory requirements. First, I want to talk about the Code of Ethics. For most people in the medical field and those that come to us for care, the Code of Ethics are the standards that we live by. Honesty, integrity, and accountability are some of the qualities we hold close. It is true that at times, due to resource allocations, we have to put some of our hospital's needs for equipment aside till we can find other ways to pay for them. There are limited resources. Sometimes programs and equipment get put on the back burner. Fundraising or asking for donors to pay for resources can be a way to cover costs. Medical malpractice. If we don't follow the Code of Ethics, there is a possibility of medical malpractice suits. If our doctors don't hold themselves to a higher standards, they could very well lose the right to practice medicine, as well as having to pay large fines that the hospital will have to pay as well. And that would take money away from the programs and the needs for equipment and the patients when it is most needed. Malpractice occurs when injury is done to a patient due to negligence by the hospital, doctor, or healthcare professionals. It can result in a fine for both those in the medical fields involved. Loss of employment and or loss of license to practice medicine. References.